Good morning and welcome to the Jacaranda City. I'm Prof. Joshi. I'm the chairperson of the Paediatric Cardiac Society of South Africa and a interventional cardiologist at Steve Biko Academic Hospital and the University of Pretoria. Congenital cardiac disease is one of the passions that I have personally, as well as one of the core passions of the Paediatric Cardiac Society of South Africa. Congenital heart disease is the most common congenital lesion that we see in children. Of every 100 births, one child will be born with a congenital heart disease. And if we imagine that we have about 1 million births in South Africa every year, that means we have thousands of children that are born with congenital heart disease. There's a broad spectrum of different types of treatments. Some of them might involve medication. Some of them might require congenital heart surgery. Some of them might be repairable in a minimally invasive method, such as in the cath lab, to close a hole or a stent to open up a blockage. One of the messages for Congenital Heart Awareness Week this year from the Paediatric Cardiac Society was that broken hearts can't wait. Therefore, we want to try and educate our members, we want to try and educate the general public that if we pick up these lesions early, we can take these children to the cath lab, we can intervene, and often in what is a one-day procedure, we can close these defects and the children can lead a normal life thereafter. Working in the cath lab is kind of like being a mountain climber or a pilot. They have to plan in advance for any possibility. So planning, equipping yourself with the correct technology, equipment and knowledge is essential to ensuring that when a baby comes into the cath lab, they leave with a successful procedure and they leave without any complications. Our core is that the patient should get the best care possible. And part of that is planning on time, making sure that everything is organized and that your cath lab runs pretty much like an airport or an airplane, or someone who's going mountain climbing. You have all your different ropes, you have all your different clips. In case you fall, you're going to be safe. We have a lot of students that actually come up to us and say, so why did you choose pediatric cardiology? There's often a lot of difficulty that goes with doing pediatrics. Our patients can't talk to us. We have parents to also deal with because the parents can be very anxious. The good part about pediatric cardiology is the vast majority of cardiac lesions can actually be managed. They can be treated, they can be fixed, and 90% of the patients will lead a completely normal life. Being involved in exercise, activities, normal schooling, have a normal career, and even have children of their own. And that for us is the biggest promise in pediatric cardiology, is trying to normalize somebody's life so that they can actually succeed and they can flourish and they can thrive. One of my first really touching moments, and something that I really will never forget, I was still a pediatric registrar, still training to become a pediatrician. And this baby was brought in by this mom, and this mom was absolutely distraught. The baby was struggling to breathe, completely blue. And I was fortunate enough to have a structure and to be working in a place where we had access to pediatric cardiologists, where we had access to imaging. We made a diagnosis on this particular child of a coarctation of the aorta. I was alone at the hospital. I instituted the management of this patient using prostaglandins, and literally in front of the mom's eyes and my eyes, as the medication ran in, this child got better and this child stabilized. We took the child to ICU, and a week later this child was operated. This child is no longer a child. He now comes to the clinic. He's 24 years old, and he comes and he shows me all his gaming stuff and all his new sort of things on his phone and pictures of his girlfriend. And for me, that is absolutely the most defining moment of my life. And when you leave the cath lab to tell this mom the procedure went successfully and well and that hole is closed, there's nothing that's better or gives you more joy than actually getting to see the joy in that mom's face and the joy in her eyes. And that's kind of the reason why we do what we do and we go to work every day. I am happy to announce that from the 4th to the 8th of May 2026, we will be hosting a hands-on, in-person Pediatric Interventional Cardiology Congress. The aim of the workshop is to get all of our fellows, all of our doctors, technicians, radiographers, hands-on experience and training on interventions such as PDA device closures, ASD device closures. The project has gotten bigger and bigger and bigger as time has gotten along. I envisaged a small little collection of a few pediatric cardiologists within our own unit, and that has expanded into something that we can live stream, and we can involve our fellow colleagues within Africa, within Kenya, Malawi, Zimbabwe, Zambia, Nigeria, and together with SMT, together with the Pediatric Cardiac Society and with SA Medical, we have this opportunity to train pediatric cardiologists in South Africa on how to perform these procedures, so that of these thousands of children that are born with congenital heart disease, we can actually start fixing their heart problems in the cath lab. We are very fortunate that we have an international proctor who's going to be joining us. She is a world-renowned pediatric cardiologist. Her name is Prof. Mai Al-Sayed, and she has agreed to proctor us for the entire week. Prof. Mai Al-Sayed is one of the foremost interventional cardiologists in Africa and in Egypt. She's involved in a lot of international conferences and live streaming of a lot of cases. And we're hoping that by having her present together with all our local expertise, we can get our training cardiologists also excited about the field of interventional cardiology. So we're very excited to have Prof. Mai, and we really look forward to working together with her as the entire Pediatric Cardiac Society.